if you guys don't mind, I think we'll just dive in. How's that? And Scarlett will just let everybody in as they come in. So that'll work out well. And of course, anytime you have questions, please drop those into the chat, and we will kind of go from there. So there's a Q&A. I guess it's a Q&A. So yeah, that'd be fabulous. So we're going to get started. Thank you very much for taking time out of your evening tonight to join us. We're going to talk about hormones, and we're going to talk all about you, and we're going to talk about libido and all kinds of really fun things. So here we go. I guess I got to click on my slide deck here to be able to. Okay. So hormone issues, holy cow, this is an enormous subject. This subject is something that we could probably talk about for years. And quite honestly, when we look at hormone issues, these aren't things that just recently cropped up. Usually they're subtle symptoms that we've been trying to figure out and maybe even avoiding for many years. But what I'm finding is that there are so many women that are having hormonal issues that really start maybe even in their teens or in their 20s. And then they just kind of evolve or change. And some of them become more pronounced. And what I'm also seeing is that premenopausal issues can really start in someone's 30s. Now, and what I mean by that is that a lot of times women will come in and they say, I'm having night sweats, I'm having hot flashes, I'm not sleeping very well. But then when we test their estrogen, progesterone, testosterone, they're actually in physiologic range. So really what's going on is these symptoms we have classified or categorized as estrogen issues or lack of estrogen, and they're really not. So although hormone symptoms can kind of overlap, they're not complicated. And this, honest to God, is not rocket science. It's basic physiology. But if we don't really know what's going on, then we can't make really great choices for ourselves. And we certainly don't want to live days where we're in misery. That is just no fun. Because, you know, quite honestly, time is the one thing we can never recreate, right? We can make more money. We could buy a different house. We could buy a different car, but family and time are things that we just don't get back. Oh, and there we go. So this is really fun. I love this slide because when we're looking at this, it really identifies a lot of this menopausal symptoms that we start experiencing earlier in age, and where they actually could reside, or some of the symptoms and how they could correlate together. So, you know, a lot of people say, you know, I'm gaining weight, I'm kind of stressed, I've got a lot of vaginal dryness, and I'm just kind of anxious, but I really am not very interested in sex. And that changes even in our 30s, especially after we've had babies. And that could definitely be a hormonal issue, but it could very much be a stressor issue. And all of that plays together in libido, whether we even care to be intimate, let alone are able to be intimate. And of course, the longer you go without being physically intimate, there are a lot of physical changes that can happen. And we certainly don't want that to be debilitating. And we certainly don't want to lose marriages over this either. So let's talk about vaginal dryness. A lot of times when you go to the doctor, it's like, oh, honey, it's just vaginal dryness. It's not that big a deal. But it really is. I mean, it really, really is. Because if you don't use it, you're going to lose it. And if vaginal dryness is left unchecked or untreated for a number of years, things can happen. Like the walls of the vaginal vault can become thinner. Then the bladder could tip in, or the rectum could tip in, or you literally could start being intimate again with a lot of lubrication and then cause some skid marks or tears, which could be very irritating. They could be painful. It can actually expose nerves. And when all of this happens, then we can actually see where the vaginal vault, the tissues become so changed that it can actually change the nerve endings, which can then lead to even more issues. There are a lot of treatments that are available. A lot of them are hormonally related. But a lot of women say, well, I have family with history of breast tenderness, or excuse me, breast cancer or uterine cancer, ovarian cancer. So I've been told I can never use hormones. That's not really 100% true. There's a lot of newer science that's out, and a lot of science that actually correlates that if you don't have enough estrogen, you could actually be more susceptible to cancers. Because the bottom line is estrogen, if it really caused cancer, I think we would have been hitting our teenage years or even our early 20s when estrogen is the highest it ever is, and we'd all be dropping dead of cancer at that point. So there are some ways to physiologically test and evaluate. But the one thing that, if you take absolutely nothing else home tonight, the one message I really want to make clear is that physiologic levels of hormones being replaced is the only type of hormone that should ever be replaced. Physiologic levels. So if you're in your 40s, 50s, 60s, 70s, we should never be replacing you back to when you were 20 or 30. That is where we can set you up for some real issues. And it can be pretty serious. So we don't ever want to go there. You know, the first rule of thumb is to do no harm. When we look at hormones, there are several that are commercially available. There's several creams that are available in vaginal applications. Most of those are estradiol, which is usually called estrase. But there's another product called Premarin, and Premarin is short for pregnant mare's urine. Nobody on this call is a horse. As a professional pharmacist, I've been a pharmacist for almost 34 years. I don't advocate the use of Premarin. It is equine estrogens, which are derived from horses' urine. And because of that, they are replaced in what I believe are higher than physiologic dosing. So I think it should never be that high. Because when you take that either orally or vaginally, a lot of times your body will change it into things that actually have been linked to cancer. So we don't want to do that. And we could go all the way back to a study called the Women's Health Initiative, which was abruptly halted in the early 2000s. And we know why it was abruptly halted, because a lot of women were actually dying of breast cancer when they were on synthetics and equine estrogens. And there's been other studies since then in France and also in the US that have also given us better information as to how we can still use estrogens to help preserve not just vaginal tissues, but also to preserve our mental acuity, our bones, and our ability to move. But if you want to go with a non-hormone route of enhancing vaginal dryness, we can always use oxytocin, which is a natural hormone that we'll also talk about in a little bit, that is used, that is produced in your body when you are intimate, and it does help lubricate the vaginal vault. We also use sodium hyaluronate and vitamin E to help as really good moisturizers. When we look at lubricants, it's very important to use something that is silicone-based and water soluble, because those also have antimicrobial properties. So you want to stay away from anything that has glycerin, and you really want to stay away from anything that is petroleum-based, because that can actually decrease the lining of the vaginal vault. So the other thing that I'm hearing from a lot of women is, boy, those creams are messy. And sometimes when we don't have a lot of strength in the vaginal opening, so it doesn't actually close up, you put the creams in and they just fall right out. And that's not going to do you any good. But the other reason why creams are probably not the best option for a lot of people is that if you use your vaginal creams that are estradiol in nature and you're intimate, your partner, if you have a male partner, is going to be covered in that cream. And we don't want to cause growth of the prostate. That's not a good thing for guys. So in that sort of situation, sharing is not caring. But we can use estriol, which is the final metabolite of the 3 estrogens in a human body. And we can also compound those into small vaginal suppositories or even pearls. And pearls are a little disc that is about maybe 3/8 of an inch across and about 1/4 of an inch deep. So it's like half of a pea or half of a lentil. And they're very easy to use. And of course, they cause very little mess. And so you don't feel wet and kind of sticky the next day. And that is very helpful for most women. And then we have a new vaginal base that is more like a gel, and it's called Allage. And it actually, when it's mixed with hormone and then put into a really nice gel base, it can be easily measured. And when it is then inserted into the vaginal vault, it stays there. It kind of sticks to the tissues and stays there. So then you don't have that immediate fallout and then mess of that. What I really like about Allage is that it's very silky, it's very smooth, and it dissipates within about 24 hours. So again, you don't have this buildup, and then you can kind of plan intimacy. So be intimate first and then use your creams or gels or suppositories afterwards. We also can compound with other components called Mucilox, which has some mucoadherent properties. Sorry, there's like some fuzz in this room that's driving me crazy. I think it's because the kitties sleep in this room. But Mucilox, when we combine it with a gel or a cream and some active ingredient, it again will stick to any irritated area. So if you are intimate and you have some burn marks or skid marks in the vaginal area, we can apply medication to that area. It will actually stick and heal faster.
Hey, Michelle, sorry to interrupt. There's a question from Evie. She says, what about sea buckthorn oil for dryness?
Sea buckthorn is great for oral use, especially for resalivating oral cavities. It helps a little bit for vaginal, but not enough where we see good pH differences. Now, some people use coconut oil as well, but you have to be very careful when you're sourcing any type of outside oils for vaginal use to make sure that the pH is appropriate, and also that it is purely organic and sourced from either plants or manufacturers that are going to be able to guarantee its purity. Because sometimes it has other ingredients that may actually degrade the tissues or even cause more irritation. And that's not what we're trying to do. So mood swings. So I'm not sure who is unmuted, but anyway, the mood swings are not all in your head. So when you have serious situations, especially when they work with your mood, whether it's depression or anxiety, a lot of these situations can be caused by what's actually going on in your gut. Because 70% or so of serotonin that you make in your body, which serotonin is your happy hormone, it's your happy chemical, it's made in your gut. So if your gut isn't happy, your body won't be happy. And that will directly affect your mood, whether it's then classified as depression or anxiety or both. And that's why we take antidepressants that are called serotonin or selective serotonin reuptake inhibitors, so that it doesn't actually reabsorb, it just sticks around in the bloodstream and supposedly makes you happier. But again, a lot of people find that they don't work as well, or they have side effects that are that they just can't handle. The side effects are worse than what they're experiencing. So for that, we have a wide variety of other options, and most of those are available over the counter. Of course, we always try to address things when it is associated with the gut, because if we don't get to the root cause of what's going on, it does make it a little bit more difficult, and then time elapses and then we get frustrated. But L-theanine is a natural amino acid that helps us to be happier. So if you're having mood swings, especially that are then associated with being able to sleep, or I should say not be able to sleep. So if you're having a hard time getting to sleep and staying asleep, you can use 200 milligrams of theanine first thing in the morning to help with anxiety and or depression. And then you can use anywhere from 200 milligrams at dinner time and then again at bedtime. But we have to be careful about how much caffeine we're also taking in, because for those of you that are having a 2-3 o'clock in the afternoon slump and you're grabbing some caffeine to perk yourself up, that can actually adversely cause you to be awake. It can actually change your sleep waves and can keep you up at night, where you might be okay falling asleep, but then you'll wake up, bing, and you won't be able to get back to sleep. That can also have significant changes in your melatonin level as well as your vitamin D level. So here we are, hot sweats, night sweats. Night sweats are, I think, one of the worst side effects that a woman could ever experience. They are not sexy. They are gross. From what a lot of women are describing, they make you feel like you've been run over by a Mack truck. You just cannot stand your skin because of how it just causes you to be warm from head to toe. Sometimes you radiate heat, sometimes you don't. Sometimes you just turn pink. And it just makes you feel yucky. Well, do they really go away with time? And for a lot of women, they don't. And the reason is because they're not necessarily an estrogen-driven deficiency. A lot of times they are either a serotonin issue or a dopamine issue, which again, go back to our happy hormones, our happy chemicals. They could also be an issue with whatever's going on in the gut. But most of the time, they are due to chronic stress. So chronic stress is, it's a killer. It's just one of those things. And a lot of times when we're stressed, we then reach for a little bit of alcohol to kind of help calm us down. But there are other ways that we can go about that. Sometimes hot flashes and night sweats have to do with dehydration, and sometimes they can cause dehydration. Sometimes they're a nutrient deficiency, and sometimes they're a protein deficiency. All of this goes back to libido, because if your hormones are not balanced, if you're overly stressed, you just don't care to be intimate. And part of that is a physiologic response, because if you are mentally or metabolically stressed, your body isn't supposed to reproduce. And most of our libido is a Paleolithic response to wanting to reproduce. So if you're still menstruating, your libido is the highest, or when you want to be most intimate, is usually about 7 to 10, maybe 14 days before your cycle. Well, that's because that's about when you ovulate. And of course, libido is supposed to go up at that point so that you would be potentially conceiving. Well, that seems to change quite dramatically as women get into their 35s, 40s, 50s, 60s. And we do see it in women younger than 35 as well. But perimenopausal changes really start happening in our 30s. And a lot of times, professional prescribers, medical clinicians will start throwing birth control pills at people. And that may be a quick fix, but it may be detrimental to your hormonal changes further down the road, because birth control pills are synthetic estrogens, and they can detrimentally change your gut biome, not just immediately, but for a long period of time. So although they may take care of your issues now, your prescriber is not going to let you have birth control pills past probably 50 years of age. So then what are you going to do? Yikes. Because once you take those birth control pills away, then you're going to have a slippery slope where those menopausal symptoms are going to be potentially outrageous, and they can be a little bit more difficult to take care of, make physiologic changes. It's also very common that as stress goes up, we start to gain weight around the middle. And that is because of some chemical changes happening with how the pancreas actually responds to glucose leaving the cells and depositing into the bloodstream or into the gut. And because the pancreas is right around our midline and it tries to shove glucose back into our cells, well, that doesn't always happen very well. So then that glucose turns to fat because perhaps you're not burning it up as energy. So when it turns it to fat, it sticks around our middle. So that's why we get these bulgy tummies and bigger butts and thighs. It's a physiologic change. But a lot of times what's also happening is when you're stressed, your gut is making significant changes as well. And a lot of times women will drag their husbands in because they are falling asleep after dinner and their tummies are getting bigger and they're having trouble having an erection, having an ejaculation, or they just have a lot of mood issues. Perhaps they're growing moobs, man boobs. And if we fix him first before we fix her, we certainly don't want marriages to fall apart because then he's potentially going to stray. We don't want that to happen. So it is very important to take a look at what's going on with the female as well, because let's face it, ladies, who do we take care of first? Everybody else before ourselves. We just kind of do that. We take care of the kids, we take care of the house, we take care of our husbands, we take care of everybody else, and we really don't pay real close attention to what's going on with ourselves until we're close to menopause, because then the symptoms that we're experiencing tend to be huge and we just can't ignore them anymore. If we also have quite a few toxins in our body will actually start to develop extra fat, because if you are polluted, the way the body physiologically takes care of that is to dilute the pool of pollution. And that's where a lot of times toxins will actually sit in the fat. And again, all of this circles back around where libido just hits the tank, because if you're toxic, if your gut's out of whack, if your hormones are not optimized and in balance, your body does not want to reproduce. So we can fix this. One of my most favorite things that we use is oxytocin and also some herbal supplements. So I talked a little bit about tummy bulges and what can happen with that. Oh yeah, stress eating. Oh my gosh. So when cortisol goes up, we tend to crave things. And that's because of a chemical reaction that actually happens in your stomach. And there's a couple of chemicals in there. One's called leptin, one's called ghrelin, and that will change how you actually absorb foods and when you absorb foods. And that could also contribute to a tummy bulge. Now, some of this can actually be related to thyroid, so we don't want to forget that either, but it can be evaluated, it can be tested, and we can fix it. So here's thyroid. So when you take a look at this picture, you're thinking, oh my gosh, that lady, that's a very, very old picture. But when you look at her face and you look at her neck and her fingers, her hands, she's all kind of pudgy, right? So she's kind of thick through here. And her eyelids actually form over the top of, they kind of like pull down, and she's puffy and she's gray and her fingers are swollen and her neck is she's real swollen in this area. And all of that has to do with thyroid. So yes, this picture is almost 100 years old, but there are so many people today that look like this as well. So let's fix all of these pieces. We have to test, and then we have to monitor and perhaps use prescription medications to make things better. These are a few of the prescription medications that are often prescribed. But if we're going to test, especially thyroid, because hormones can play against thyroid. If your estrogen is too high and your progesterone's too low, even if your estrogen is still within physiologic range, if there's not enough progesterone, the body still sees it as high. It can actually block metabolism that thyroid controls. If you are stressed, your cortisol could be high, and it will actually block your thyroid as well. It will actually convert it to non-active thyroid. So that's why when we test thyroid, we have to look at more than just TSH, because we're missing 90% of the puzzle if TSH is out of bounds. The other issue is that the TSH range that is being used as a gold standard was a range that was set in 1934. And that range is based on testing parameters that were pretty vague back then. But the way we're able to test thyroid hormone in the labs that we currently use, it is so much more specific now that the range is really much higher than it should be. It should be anywhere from 0.5 to 2, not anything above 2. Most endocrinologists will treat any TSH that is getting even close to 2. But once it goes over 2, there's further testing is done, and then we actually jump into therapy. Therapy is available in synthetic levothyroxine and liothyronine. Those are synthetic hormones, but they are also bioidentical, so they match what's physiologically in your body. I think it's better to compound those because the commercially available products actually contain lactose, which can negate or drop the absorption of both of those hormones by as much as 50%. That's actually in the package insert. Desiccated porcine thyroid is amazing because it contains levothyroxine and liothyronine and a little bit of T1 and T2. There are several commercially available forms of desiccated thyroid. We also compound with raw thyroid powder, but a lot of times the commercially available products do contain lactose and sugars. And again, a lot of times people have problems with that. If you have an autoimmune thyroid issue, you're probably looking at concerns with fertility and libido and hormone balance. But if you do have a diagnosis of autoimmune thyroid, which could be Hashimoto, could be Graves, it could be a combination thereof, we need to really take a very close look as to whether or not Armour Thyroid, Nature Thyroid, NP Thyroid is the best option for you as a prescription, because some people with autoimmune or antibodies can actually build antibodies against these different types of medications. And we're trying to fix something, not make something worse. So it's important to continue to monitor TPO, which is a thyroid antibody, along with thyroglobulin, which is another antibody that help to indicate whether or not you have Hashimoto or Graves autoimmune thyroid problems. We also need to look at iron stores, zinc, as well as selenium and vitamin D. And a lot of times we can get these supplements all in one capsule, which is really nice. So let's go back to stress. What can stress do? Well, I don't know about you, but boy, most of these issues sound really, really familiar. And I literally talk to people multiple times, probably 20, 30 times a day about all of these issues. Somebody may actually call about aches and pains. They may talk about cravings. They may talk about that they have high blood pressure or increasing blood pressure and what to do about their cholesterol and triglycerides. But really, one of the most concerning issues of our population today, especially over the last year, is that our blood sugars are climbing. We are seeing more and more pre-diabetes and diabetes diagnoses. which can cause inflammation, which can cause hormones to be out of whack. And anytime that you have a higher blood glucose level than what is considered normal, it can also drop your libido. Big old circles, huh? Just big old circles. Stress is the #1 killer of the United States population. It is also linked to the most common reason why people go to see their medical professional. Most of the time, stress is very commonly related to high blood pressure. It's commonly related to either high or low cholesterol. It can very easily be related back to what's going on with foggy brain, mood disturbances, depression, anxiety. It can very easily throw off your gut. So maybe you are having burping where you may have esophageal reflux. You may have digestive disorders where you have a very fast mobility in your digestive tract, or maybe a very, very slow one. And again, these are very common situations why you seek out medical attention, but they can be taken care of by understanding some very easy concepts that you can control today without a prescription, without even interrupting your day-to-day routine. So we start with drinking enough water. We start with breathing, a little bit of mild exercise, but quite honestly, I'm going to skip over this one and come back. If you can literally go outside for 10 minutes a day and be outside. Now, granted, we don't have a lot of sunshine right now, but just go outside and be outside for 10 minutes a day. And the reason is, the one thing that I learned from Dr. Ginsburg today is that a lot of us, because we are so stressed and because our cortisol is just chronically high, our body functions, but we haven't told our brain that we're awake, and we haven't told our gut that we're awake because we're not absorbing any natural sunlight, which our vitamin D levels are usually super low anyway. But also, if you can go outside for just 10 minutes in the morning before you actually go to work, you will actually have better digestion. You'll have clearer thinking. You will have better mobility, and your mood will increase. Now, if you can go outside during that 10 minutes and you can actually take your shoes and socks off and be in the ground or attached to the ground with just your bare feet, that's called grounding. It improves that even more. Really interesting. I've heard of grounding before, but I didn't realize the impact, the dramatic impact it can have on digestion. And when we are able to enhance what's going on with our gut and improve digestion, we have better brains. What she also told me about was this product called binaural beats, which is literally a sound wave therapy that you can listen to, and it can decrease your stress beta waves, which can then be calming. So you can go to YouTube. There are several apps that are available. You can plug it into your phone. You can plug it into your iPad, whatever it is that you're using, or whatever phone you're using. Put on some headphones, go outside, be outside for 10 minutes. And I'm not kidding. It only takes 10 minutes, and you can dramatically drop your anxiety and improve your overall mood. Super cool. But then she went in to talk about yin yoga, which I guess there's a bunch of apps out there on yin yoga. It's really low impact. So if you do have aches and pains or lack of mobility in your hips or your knees, you can do this. So it doesn't matter what size you are, what shape you are. And again, it takes very little time. So you can build this into your routine without dramatically changing your whole day. You don't have to restructure your whole day. And yin yoga does not have to be done first thing in the morning. It can actually be done at lunchtime or if you need some calming after dinner, you can do it then, because it's not necessarily aerobic. So you're not going to be increasing catecholamines, so you're not going to stay awake at night. So we're going to go back a little bit, and we're going to go to here, which I'm going to pick up on the meditation and the prayer, because again, that's a way that we can actually calm ourselves. So when we do some calming breathing, and if you've ever had a child and been to birth class, they talk about the fast repetition breathing, but they also talk about the soothing breathing, where you inhale for 4 to 7 seconds, hold for 1 or 2, and then slowly exhale for about 7 seconds. You can drop your blood pressure by almost 10 points just by doing that. So this isn't fancy stuff. This is stuff that you can do right now. You can do anytime during the day. You can do it even when you're in the middle of a meeting and nobody will even notice. I wouldn't recommend doing it like 10 times back to back. You might get a little lightheaded and you don't want to pass out. But if you did it once or twice within a few minutes at time, it's amazing how refreshing that can be. It lowers your cortisol so that you can actually be perkier, and it helps to modulate your hormones. Of course, we should always test. Testing is interesting. We'll just call it interesting, because a lot of times insurance companies, which, we pay for insurance, it's nice to have, it's nice to use because we pay healthy premiums for this. And it'd be really nice to be able to use it from time to time. But when we only look at serum tests of our varying hormones, it makes a huge deal as to when you actually go to the lab for a lab draw. So when you have your blood drawn first thing in the morning, we're going to be able to capture better examples of what is actually physiologically happening in your body. Because usually hormones are spit out between 4 in the morning and 7 in the morning. And that goes for thyroid, that goes for sex steroid hormones like estrogen, progesterone, testosterone. But it also then correlates back to our neurotransmitters, which are our signaling that help with nerves and communication between various areas of the body. But if you are currently using like estrogen patches, or estrogen creams or progesterone creams, whether you're buying them over the counter or getting prescription, you're not going to see a lot of hormone in the blood because it's not supposed to be there. Hormones are oils and our blood is mostly water. So we're supposed to make these carrier molecules called sex hormone binding globulins to latch onto those oils to then carry it off to target tissues. So it always reminds me of the Jetsons, where they're kind of spurting around. And I hope everybody's old enough to remember the Jetsons, that fun cartoon. So you know how they had these transporters that would whisk them away to wherever they were going? Well, that's what sex hormone binding globulin does. It gathers the element, the hormone, and whisks it away. So when it's traveling down the bloodstream, you really don't see a lot of it because it's bound. Now we can see a cellular representation of how much hormone is in the body by looking in saliva, because it passively migrates into the salivary pool. So if we test on very specific days, if you're cycling, or any time of the month, if you're not, then we can actually see what's going on. It's a really good idea to get a baseline in your 30s or 20s, because then we have something to compare it to. Because we've even found, even with identical twins, that there are a wide variety of factors that can change their baseline hormones. And so even identical twins could have different kinds of levels, different baselines. It's awesome to look at especially sex steroid hormones in urine, because a lot of times we can look at the metabolites. So let's say you're having menopausal issues or perimenopausal issues, and you're put on bioidentical hormones. So we give them to you, but then we don't really know how your body is using those. Is your liver going to be changing those to a good pathway or maybe one not so great? And most of the time, that's a genetic component. So if we test our hormones, we probably should know how we are genetically set up to then utilize those hormones. And that's also very helpful because when we do genetic testing, we can also see whether or not you utilize your vitamins and minerals appropriately, because our cells cannot utilize vitamins and minerals unless they're activated. And a lot of times we don't have specific enzymes to activate them because genetically we just don't do that. So if we know what's going on, we can make really good choices for ourselves. So genetic testing, this is my favorite type of test. It literally is a cheek swab. You run it around one cheek, run it around the other cheek, you put it back in the tube, you send it off, and you get these results. And it looks at 36 core elements that identify everything from how do you utilize caffeine? What happens when you eat salt? Should you exercise like distance running or short term? Is cardio your friend? Is it not? What's going on with your brain health? Do you have toxic overload? Even what's going on with your thyroid, your internal organs, and also how quickly you are aging, which is really important because I've never met anybody yet who's really excited to get into their 60s and 70s and be toting around this huge bag of prescription medications just so that they can get up and move in the morning. I've never seen anybody excited about doing that. What I have seen people excited about doing is reaching our years where we can retire and then go do all those fun things that are on our bucket list. So if we know a lot of things about our bodies, genetically, what's going on, how we can make changes for ourselves, then we are able to build ourselves a better pathway toward optimal health. So if we are going to continue to do some testing, these would be some of my favorites. Now, you're probably thinking, but Michelle, all of this is just really expensive and it may or may not be covered by your insurance. Well, I will say that I've done the 3x4 genetic testing, and what it allowed me was some peace of mind so that I can understand what is going on in my gut, what is actually starting in my mouth, going on in my gut, so that I can further balance my hormones, that I can make sure that my thyroid is functioning really well, so that I can move into my 60s and my 70s and be the picture of health. Because I do believe that we all want to feel and be as young as possible for as long as possible, right? I want my skin to be smooth. I want it to be supple. I want it to be full. Gosh, it'd be nice if I could just like tuck it up here a little bit, because nobody wants to have all of these big lines or fine lines that age us so quickly. And it's not just our face, but everywhere, including our vaginal vault, because we want to be vibrant. We want the ultimate picture of health. So we need to look at how to optimize that.
Michelle, where do you get the genetic testing, the 3x4 genetics?
That's a really great question. Right now, I know of one practitioner in the Skagit Valley that is doing this, and her name is Toni Marthaler. So it does have to be ordered by somebody who is trained with the use of these tests. So Toni Marthaler is in Green Bank. She does telehealth or telemedicine visits, so you don't necessarily have to drive all the way to Green Bank. She does a preliminary consultation. She can order the test for you. It's literally mailed directly to your house. It comes in this really sexy black tube, and inside the tube is all of your testing requirements, including a prepaid postage envelope. so that after you do your testing, you put it back in there and you just send it right back to 3x4 Genetics. And then she will actually go through the results with you. So she sets up a virtual seminar kind of like this. It's all very HIPAA compliant. It's very, what I want to say, private. And she walks through every bit of that with you. And so you can learn about where your depression's coming from, where's your anxiety coming from, what are you looking at down the road.
And how much does that run?
So I paid $550 for all of that. And we spent a good half hour, 45 minutes on the phone before. And then it took a little bit, about an hour or so, consultation afterwards. And what she told me, and I don't mind using myself as an example, she's tested my husband, and I also have a daughter who's had several fairly significant concussions. So she's classified as traumatic brain injured, and she has a lot of allergies and other things going on. And she keeps tearing her ligaments away from her bones. So she's had 2 hip surgeries. She's had 5 arm surgeries, and she's had a knee surgery now, and she'll be 27 in June.
Oh, she's too young for all that.
Absolutely too young for all that. So we wanted to find out what the heck was going on.
Right.
So we did the 3x4 Genetics, and it told her so much information. And looking back,
yeah,
it's like, oh my golly. So yes, $550 is a lot of money. That's a lot to budget for. But the amount of information that you get when you can actually evaluate your mood and your brain health and how toxic is your body.
Yeah.
Then it helps you can actually choose your vitamins and minerals so that you're not literally peeing them out.
Right.
That you can choose the right brands, the right forms.
Yeah.
For example, do you actually convert your B vitamins to methylated form? Because if you don't, then they just pile up and they don't actually get to the cells. So you're starving your cells and they don't make enough energy. Well, we all know what no energy feels like.
Yeah.
But if you do methylate, if you do convert those, you shouldn't be taking methylated vitamins, because you could then be adding fuel to any cancer fires that you may have brewing and not know. So we can overdo it with some vitamins. So again, it's best to know.
Yeah.
Now, what I will say is that some people, when they get a hold of all this information, it kind of freaks them out. And so you need to know yourself, what are you going to do with this information? I don't want people to stew on things and become, more stressed than they are, because that's not going to help anybody.
No.
Not one bit. Now, vitamin D is really, really important. And I understand that if your insurance company pays for vitamin D testing, it can still be outrageously expensive. So there are ways. Sometimes hospitals have clinics where testing is like $40 or something like that. You have to go on a certain day and certain times and whatever. We have vitamin D testing, and I think it's $75. But what's really important about vitamin D is that if it is not close to 70, we have seen a higher incidence of cancers. We've seen a higher incidence of depression and anxiety. We've seen lack of immunity just because vitamin D is low. So it's really important to know where that's at. And even if you take vitamin D, so I take anywhere from 5 to 20,000 international units a day. And my vitamin D level that I tested in January was 48. So, and I use professional supplements. I'm not grabbing something from Costco.
Yeah. Okay.
That's a whole other discussion. I'm using professional supplements that are considered medical foods. I am mostly Northern European descent, and I do not assimilate vitamin D very well. So I rotate my vitamin D and primarily use liquids so that I can bring it into my body. My vitamin D level was 48. I was thrilled because it had been 18. And yeah, that's not good for anybody. So these are what the hormone kits look like, and they can be combined. Some of them are saliva alone, some of them are saliva and urine, and some of them are actually saliva and blood spot. And if we're actually looking for toxins, we can actually do urine and blood spot. And they vary in price from, well, it depends on what we're looking at, right? So like I said, a vitamin D test is around 75. A basic hormone test is 200. In advanced can be 260. When we start looking at neurotransmitters, or if we add thyroid, we could be looking at $350 to $400. And we can give you very, very core specifics. But what I'm going to say about all of this is that you need to have a discussion with your healthcare practitioner, because you may have this laundry list of symptoms and you may want so much to have a better pathway to health, but you have to start with your medical provider, because they are the ones that will need to be brought into the discussion about possibly writing prescriptions for maybe anything from libido, like oxytocin nasal spray, or to help decrease neuroinflammation, like synapsin nasal spray, or perhaps writing bioidentical hormones to help optimize those hormones so that you can have a nice, healthy brain, healthy bones, great mobility, and a fabulous sex drive. I don't write prescriptions. I am more than happy to help guide you on your pathway and also guide your practitioner on how to manipulate doses, or even start with doses, or even change those doses further down the line. I can help with all of that, but I don't write prescriptions. And I will tell you, you can add therapies that are over the counter, but they may not be enough. You're going to need those prescriptions.
Now, I have a question too. Are most of the things that you've talked about, like the oxytocin, the Alage, Eucalox, vaginal pearls, those type of things, are those all prescriptions?
Yeah, they sure are. So Alage is a base that we put like estriol into to help with vaginal dryness.
Okay.
Oxytocin is a nasal spray. That
Okay.
is a prescription, and we use that for depression, and we also use it for libido. And quite honestly, we've seen a lot more prescriptions in the last year with oxytocin used for grief.
Oh.
Yeah, and yeah, but you know, it is what it is. But yes, all of those are prescription, and we can help you with what is best for you. We can make you a list so that you can take back to your prescriber, your medical professional, so that you can talk to them about that. Because
Thank
the
you.
bottom,
Thank you.
sorry,
Thank you.
you're welcome. Thank you so much.
There's
Because
another question, Michelle.
Yes,
I'm
dear.
sorry.
No, go ahead.
Mary asked, what about progesterone? Is it good to use a progesterone cream after menopause? And if so, how often?
Fabulous question. I don't think you should wait till menopause. I think in your 30s, 40s, I think you need to test and see where your progesterone's at. Progesterone is the first hormone of all of the hormones that tends to decrease with age. And the funny thing is that when we're stressed, cortisol actually binds to that progesterone receptor. So even if you're making enough, you may not actually be utilizing it appropriately. Progesterone is really important to use either orally or topically, which is different from the use of estrogens. Most of the time using oral estrogens is not the optimal way to do that. But progesterone is very calming. It can be very relaxing. And hopefully you have some cholesterol to actually start making some hormones on your own. Because with the use of more and more cholesterol medications, most of the time our cholesterol isn't high enough to even make hormones. And that can be a real problem, because if you don't make them, then you've got to supplement them somehow. And usually those symptoms are overlooked. Oral progesterone is something you do not have to wait till menopause to use. If you are still cycling, because progesterone is highest the second half of your cycle, so days 14 to 28, where you start cycling or bleeding again on day 1. So we can use progesterone in a cyclical pattern and use that to optimize estrogen load and even to decrease testosterone. So if somebody has, facial hair growth, pre-diabetes, maybe they have high androgens, things like that, polycystic ovary disease, we always want to add progesterone. We can use pregnenolone, which is the precursor to progesterone that is available over the counter. But again, even though you can get it over the counter, that doesn't mean that it is super safe to take. We need to know what's going on in your body before. We got to know what your levels are before you jump into this stuff. If you've already jumped in because you're using an over-the-counter progesterone cream, some people use it for migraines as well, we can still evaluate your hormone levels. My recommendation would be to start with salivary and then also urine metabolites, so we know what you're actually using or utilizing those hormones and producing. Progesterone in menopause, absolutely, because anytime you have estrogen being applied, you really should have progesterone on board as well. I don't care if you have a uterus or not. To me, that's absolutely irrelevant. And the reason is because I can probably guess the reason why they pulled your uterus is because you had a hormonal imbalance to begin with that was causing excessive bleeding. And just because you remove the uterus doesn't mean that that hormonal imbalance just magically got fixed. No, what happened is they took away your symptoms of excessive bleeding because you don't have a uterus anymore, but that doesn't fix a hormonal imbalance. So progesterone in menopause, again, should be used. In menopause, if you're no longer cycling, so whether you've had a surgical menopause or a natural menopause, you can use progesterone every day. And progesterone is usually used at bedtime because it helps with sleep and it helps to normalize sleep patterns and bring those beta waves down so that you can actually stay asleep at night. So does that answer your question? That was a lot, wasn't it? That was a lot. So I hope that was enough there. So when we're looking at replacement of hormones, the commercial products are just a few doses deep. And, estrogen patches are usually estradiol or synthetic. And there's probably, I think there's 5 to 7 strengths that are available. Well, you may be one of the lucky ones and may just hit it right on the nose and be perfect for you, but that isn't necessarily always the case. We can individualize, customize therapies by using compounded medications because, quite honestly, in my situation, my hormone needs during the winter months are a little different than what I need during the summer months. And again, that has everything to do with going outside. Yeah. Cortisol levels are different. They're lower during the summertime. I'm spending more time outside. I'm getting more natural vitamin D, and I need a little bit less. But in the wintertime, things are a little bit crazier. Life is a little more hectic. I'm not outside as much as I'd like to be. I mean, let's face it, it's yucky in the Pacific Northwest in the wintertime. I mean, it's gray. We woke up to fog this morning. It was so thick, I couldn't even see, what was at the bottom of my hill. And we don't get a lot of sunshine. And when the sunshine is out, we're at work and we're stuck inside. Nice. Yeah. So I hope you can all get out at break time or lunchtime and absorb some of that. So when we're able to compound remedies for you, we can hone in on exactly what you need at any given time. But then also we can figure out exactly what type of delivery device is going to be best for you. Some people prefer a sublingual troche. So that's what these little white squares are. Those squares can be broken up halves, it could be a whole, a half, or a quarter, and they're literally sipped underneath your tongue toward the back, and they just slowly dissolve. It takes about 20 minutes or so for them to completely dissolve. Otherwise, we can make drops in a sublingual dosage form, and we can make creams that can be rubbed into the skin. We usually do all of that with estrogens. We can do that again with progesterone. We can add testosterone in a cream or a sublingual drop or troche as well. And we can combine some of these as well. So some women, when they get their levels pretty well honed in, we can add the estrogens and the testosterone together in a cream, apply that in the morning, use progesterone at bedtime. And if we need to, we can supplement oxytocin nasal spray to help boost that mood and to help you feel closer and more intimate with your partner. So if you have depression or anxiety, we would use it every day, 1 or 2 sprays in the morning. But if you're having problems with an orgasm, for example, number one, maybe you just don't even feel like being intimate. But for other women, if they are on antidepressants, they just can't seem to have an orgasm. They can work up to it, but they just can't fall off that cliff, right? It just doesn't get there. Whether you spend time with manual manipulation or even if you're using vibrators, some women still just can't get there. Oxytocin nasal spray, used a few sprays before, like 10 minutes before intimacy, can change all of that. Now let's talk a little bit about herbal medications. These are products that are usually available over the counter, and they help to supplement different areas of the hormonal cascade. So black cohosh can be used for hot flashes, evening primrose oil as well. Chasteberry, which is also called Vitex, actually helps to enhance ovarian health. So that's going to help support progesterone. If you're in menopause, that is used less often. DHEA is a precursor to testosterone, so it helps again with libido. DHEA is the most common hormone in the body. It is primarily produced in the adrenal glands, and it helps you feel kind of this overwhelming sense of well-being. And when we see estrogen levels up, progesterone low, testosterone maybe even normal, but DHEA low and cortisol high, that can set people up for cancers, and we don't want to see that. DIM is short for diindole methane, and IC3 is short for indole 3 carbonyl. You don't need to know those big old long words. All you need to say is DIM and IC3. And those are herbal products that we use to help metabolize estrogens and the other sex steroid hormones more effectively, so that you metabolize those to hormones that we can actually use in the body that are not going to necessarily cause the uterus to overgrow, the ovaries to, overgrow ovum, and that we also don't see overproliferation of breast tissue, which can then lead to cancers. We don't want to see that. There are also some great libido enhancers out there that are completely herbal that can be started and stopped at any given time. And a lot of times the libido enhancers are not just designed for women, but they're designed for men as well. Now, I have to caution you that if you do take medications for thyroid, if you take medications for high blood pressure or cholesterol, or if you're on blood thinners, please talk to your compounding pharmacist or your nutritionist first, because you shouldn't jump into these if you have pre-existing conditions that might be harmed or changed because of that. Now, this is one of my favorite medications in all the worldwide. It's just, I love this drug. Low dose naltrexone is a prescription medication that we use for a wide variety of issues, primarily because when we're dealing with disease states, whether it's depression, whether it's an autoimmune disease, diabetes, chronic arthritis, those are all inflammatory issues. And if we have a medication that actually works right at the root, right at the cellular level to decrease inflammation and modulate the immune system, block our normal pathways that cause pain, and reduce our chemicals that cause inflammation, that cause pain, then this medication can be used for a wide variety of situations. So I've been a pharmacist for almost 34 years. And whenever I see a medication that it works for a rainbow of situations, a wide variety of disease states, I'm thinking, right, sure, how can that be? But when I look at naltrexone in typical doses, so it's commercially available in a 50 milligram, 100 milligram tablet. And when we use it in 50 to 300 milligrams, we use it for alcohol overuse syndrome, methadone withdrawal, opiate issues. So if somebody's addicted to opiates or they're addicted to alcohol, we can use low dose naltrexone in big doses and help them get off of those other drugs. But when we use low dose naltrexone, 0.1 milligram, 1 milligram, 3 milligram, 4.5 milligram, anywhere in between there, we can actually see modulation of the immune system, blocks pain receptors.
Wow.
And it also decreases inflammation. And you've probably heard a lot about COVID causing a lot of inflammation throughout the body. So even people who have had cases of COVID that survived COVID, they have these everlasting issues. They've got foggy brain, they hurt, they've got headaches all the time. Where there's actually 3 different studies going on with the use of low dose naltrexone in post-COVID people that is enhancing their overall health, that is helping them get back to their normal way of life. But we do use low dose naltrexone for a wide variety of autoimmune issues. We help it to normalize thyroid function, diabetes, but it also helps support hormone function as well. There are over 900 scientific studies and case studies to support the use of low dose naltrexone in a wide variety of disease states, including autism and including rheumatoid arthritis, Lyme disease, and autoimmune issues like Crohn's, ulcerative colitis, multiple sclerosis, fibromyalgia, chronic fatigue. So when some people take this information to their prescriber and their prescriber's like, I don't know anything about it. There's just not enough studies on it. I think 900 is a pretty decently described and scientifically studied drug. I'm not really sure that there are any other drugs out there that have got this kind of studying behind it. I literally, honestly, I don't think so. And if anybody knows that there's something that has been studied this intensively, I'd love to hear about that, because when we see this much science behind it, and this drug is only commercially available in these whopping doses, not in these little itty bitty doses. Yale studied naltrexone in microgram dosing to help with chronic pain. They also studied it in 2007 for weight loss and combined it with bupropion and came up with a drug called Contrave. Pretty cool stuff. Now, isn't this the truth? Tell me this isn't the truth.
That's right.
And I feel like this describes most women that come into the pharmacy or call me on the phone. They want to weigh less. They want to feel better. They want to have a libido. They want to have this great sex life, even into their 70s and 80s. And I say, why not? I say, why not? What you can do right now for yourself, we are more than happy to help you. We will never ask you to change your physician. We may give you suggestions on additional providers that might enhance your health journey. But what you can do for yourself right now is to take 10 minutes in the morning and go outside. Put your feet in the grass. Yeah, it's probably wet. Put an umbrella over your head and go outside. Expose yourself to the sun. Well, it's kind of cloudy and it's obscured by some fog and that sort of thing, but go outside 10 minutes. That's all it's going to take. And it will literally change your gut. It'll literally change your mood. It'll help enhance overall health. And isn't that what we're really looking for anyway? We can always talk to you about testing. We're always happy to help with that. We can always help you with what's going on with your diet, because let's face it, we can always use some improvement there. And you don't have to settle for less than anything other than good or great treatment.